Thank you for joining us, everyone. I'm Rob Havasi, the Senior Director of Connected Health at HIMSS, and joining me today for a conversation about consumerization and the consumer experience in healthcare is Corey Bakhtiari, the Head of Innovation at Argano Arbella. Corey, thank you for joining us.
Thank you. Pleasure to be here.
It's a pleasure to have you. And so I know you and I had a chance to chat briefly before this recording, and there's a number of areas we want to talk about today. But I think maybe the easiest place to start is to say, from my own experience, in the 15 or more years I've sort of been in healthcare, I have yet to have someone come up to me and say, this part of the system just works perfectly. I loved my experience. Nobody wakes up and says, I think I'm going to go to the doctor for fun today because I get a lot of joy out of being in the office and other things. So whether it's inpatient care, outpatient care, whether it's emerging forms of virtual care, everywhere we look, somebody is unhappy with some part of the experience. And I guess to start this off, I'll ask you, does that match kind of what you feel in the industry, what you see in the industry from your clients and partners? And what are your thoughts about where we are right now in the sort of patient experience of healthcare?
Yeah, I would say yes. I mean, obviously, as a healthcare consumer myself, and as on a personal level, as well as being a professional in the technology industry, I would say that this is an area that definitely fascinates me, is finding a way to apply technology to experiences that I know personally, as well as from a professional perspective. And I think I would kind of maybe break it into a few different areas to start. I would say when it comes to self-service is where I would start first. And I think the place where I experience individually, and I've heard a lot of motivation, a lot of intent behind, is the ability to self-service scheduling appointments, both in person and virtual visits. I think this can both help the individual healthcare consumer as well as the organizations delivering healthcare, in a sense, because this would incentivize an individual to be more proactive with their own care, but then also reduce the costs associated with the administrative burden for scheduling of appointments. Mm-hmm. I think that would be one of the areas that I would first start. And I think self-service is definitely going to be an area, not just in terms of scheduling appointments, but also in terms of maybe expanding into a broader sense, not just within telehealth, but in virtual care as well, moving beyond the synchronous audio-visual interactions that replace your physical ones, in a live setting, but also asynchronous interactions, right? Lower cost, more accessible options like SMS, text messaging, working with health bots or virtual assistants for individuals to be able to self-serve as much as possible. I find this, really could help, reduce also, for example, on the scheduling side, no-show rates, overall increased potential retention of individual healthcare consumers, and hopefully positively impact the patient's care journey as well.
You mentioned something interesting there, right? So nominally this conversation was about the customer experience or the patient experience or the consumer experience, depending on what part of the industry we're in and how we're looking at people. But you mentioned the clinician experience, right? And if the last few years and the period after meaningful use and the introduction of EHRs has taught us nothing, it's that the provider experience is very often difficult as well, with systems that aren't integrated well, interfaces that don't move smoothly. So again, has that been something that your clients and other people are talking about? And
absolutely.
And what can we really do about that? Are we at a place right now where we have the tools available to start fixing some of these problems?
Absolutely. I mean, I think it's, as you said, pretty well established that clinician satisfaction is at a low, I think we can say. I think from a technology perspective, an area that I think is definitely really I'm interested in exploring more so, and I've seen adoption both within service providers as well as within technology organizations that might deploy solutions for service providers. I think the one thing is process automation.
Mhm.
And there's a few different components within the process automation space that I think we can kind of dig into. I think on one hand, when it comes to digitizing your clinical encounters and automating some of those components, I think the first thing would be like dictation for clinicians. I don't think any clinician necessarily goes to school to be a typist. Maybe some folks do, but I think at the end of the day, being able to, and this is a low barrier of entry thing, right? Everybody's got a microphone. Everybody has some understanding of communication services, being able to convert voice to text. I think that would be a very easy or low barrier to entry start in this space. I think expanding this also then into an ambient kind of format. So not just the clinician speaking or dictating directly to a system. It could also begin to capture the interaction between the patient and the clinician themselves. And then this could really also, in addition to improving the overall clinician's experience in terms of not having to then recall or recollect the interaction, or maybe not engaging eye to eye with the patient itself, with the patient themselves, to capture this information. And also, if you can layer on some components around machine learning, even as something as simple as just infographics, like the bubbles are like, what were some of the topics that were discussed the most, right? Very easy way to get that clinical encounter intelligence. And I feel like that direct engagement leads to not just a better clinician experience. It feels like they're impacting more, but I feel like the patients feel that personal touch a little bit more, and therefore an interest on the side of the clinician into their own well-being, hopefully leading to a potential more adherence at the end of the day with respect to any type of care plan that they might be discussing. I
Sure.
think,
So
yeah.
I was going to say, Corey, you're taking us into a very interesting area, something that I've tried to focus on for the last bunch of years, right? When we deployed electronic health records, one of the reasons, my opinion anyway, but I think it's shared by a number of people, that we ended up with the clinician burden we have is because largely moving towards somewhat artificial timelines, we simply took analog processes, paper-based processes, and digitized them. And so we now have interfaces that replicate old paper forms rather than use digital tools in a way to streamline or make the clinician experience better. And when you started talking about voice, I think that's where you were going, right? So the simple low-hanging fruit would be to say, today, as a clinician and a patient, I go into a room, we speak to each other. Sometime later, the clinician writes down what we said in the notes and moves on. We could simply digitize that. We could record what was said. We could use OCR or text to speech, speech to text rather, and capture notes that way. But maybe there's a better way to use those tools than simply replicating the old paper-based process that we replaced with a keyboard that will now replace with a microphone. And as we talk for the rest of today, I think that's an area that's just ripe for thinkers and companies like yours to really help guide healthcare towards, not just to replicate their analog experience with digital tools, but to use digital tools in new ways to make things better. Is that kind of where you're trying to lead your clients?
Absolutely. I mean, I think what you just really underlined there is the difference between transformation and change. Transformation at its core is changing something, but making it different, right? I think change is a substitution, right? And I think what you just underlined was the fact that we tend to, when we talk about digitizing processes or automating, we tend to think about it in terms of discrete change, basically substituting what we're doing. And oftentimes that's at least the first step. But when it comes to transformation, taking this step into the digital arena and layering on other components that are now accessible because we're in the digital space is going to really drive the additional value home, I think. And that's where the return on investment really should be focused on, is that value quote. And you can quantify it and you can even qualify it. There's some objective and also subjective measures that can be explored, but absolutely. And I think the next thing that you would do in addition to moving to that digital space is then working through and talking about both what are the outcomes, right, that we want to associate with, right? Improving the clinician's experience, improving the patient's experience, maybe even there's some actual hard numbers that we can put to some of these from a KPI or metric perspective, decomposing those into strategies. So in addition to digitizing the audio of the interaction between the patient and the clinician, machine learning and other types of algorithms can layer on top of that to identify areas of importance,
Mm-hmm.
areas that should be followed up on based on a weighting or a grading of understanding or significance. And then this could present next best action models and frameworks for that clinician to drill into as well, almost in an advisory capacity.
So I mean, I love the thought of where that's going. One of the last projects I worked on in a big hospital before I came to HIMSS was a patient-reported outcomes project, right? So we were using iPads. Then that was a pretty cool new idea, right? iPads in the waiting room, or online or mobile systems for people at home to answer questions before a visit, right? And today, when someone goes to a primary care visit or a specialty care follow-up, it can often feel like you're taking the SATs all over again, right? You have a bunch of forms to fill out. There's a PHQ-9. Are you depressed? Are you suicidal? There's a whole host of other things regarding, if you're following up after cardiac surgery, there's at least 2 or 3 different, patient-reported outcomes forms that you may be asked to fill out. But in the voice example that you were giving, one comes to mind. For over a decade now, there are a couple of companies out there that have said, without specialized questions, just listening to the tone, the tenor of voice patterns, they can discern very accurately whether or not a patient is depressed, right? And you don't have to ask the questions about are you depressed, etc., but you can just discern it. Machine learning can find it in voice patterns. And so I wonder, right, if we learn nothing else from the COVID pandemic, it's that healthcare can actually change on a dime and deploy technology when confronted with an existential crisis like COVID. Telehealth, for example, was a very small part of care in the United States and in much of the world, and it became 50, 60 or more percent in some regions at some times during the pandemic, nearly overnight. Right? Within the span of a couple of months, telehealth was a dominant form of care in some parts of the United States. It has dropped back down a bit, but it remains an important part of care. So we can deploy and integrate technology quickly when we need to. And so getting back to this voice idea, getting back to this idea that we can use digital, as you said, to truly transform care and to mine information, even if we're not directly asking for it. Do we have to wait for the mythical machine learning and AI tools to really be robust? Or do hospitals, healthcare organizations, smaller practices have at their fingertips today the tools they might need to begin to tackle these advanced challenges without waiting for some, AI savior 10 years from now?
So I would say, I think your point on sentiment analysis, absolutely, very good example of where we can leverage additional components on top of that initial digital transformation. I think, yeah, absolutely. We can definitely start. There's not so much a barrier to moving forward. I mean, I think one thing that COVID also interestingly kind of exposed is almost an acceleration in both the development of drugs and treatments, but also in the approval of technologies by regulatory agencies as well.
Absolutely.
And I think that, can, and it was already sort of happening a little bit before COVID. It's basically focusing on areas of risk based on assessing the product or the service, right? The technology involved in the landscape that it was trying to approach, and not necessarily making everything go through a Byzantine process regardless. And really, I think at the end of the day, the benefit or the intent would be, if we do hopefully take away some of that administrative burden, is to remove some of the imprecise validation processes for regulatory approval. This will accelerate innovation and the use of technology, right? I think, and who knows if that's gonna stick around, but there are a lot of low code, no code type of platforms that can be easily adopted by individual organizations that don't necessarily, or individuals themselves that don't have an IT or professional development background. So I think those are the two kind of things that you need to keep in mind when it comes to the adoption of technology, right? I think obviously within the healthcare and life sciences space, there's the regulation, the compliance component. And I think if there is going to be some continued momentum towards being more precise in the approval process, I think that would be in general a very good thing. Furthermore, I think then enabling your citizen user, your citizen clinician to actually then go and begin to play around with training models on a machine learning platform using some light AI capabilities, feeding back into its own learning model. I think it's fairly then quick to and easy to deploy. And then there's a lot of frameworks out there that would make it a potential easy access. I'm a big fan of starting. I think starting obviously is the most difficult thing, obviously having some intent behind the starting, right? It's good to justify what it is you're trying to do, but there's a lot of clarity that comes with specifying intent. But I think those are some important principles to keep in mind as we look at expanding the reach of technology within the healthcare space.
Yeah, I think there's a couple of avenues there that I think we can explore, and the sort of unifying thing I think you just talked about was whether it's low code, no code tools, whether it's AI as a service or other cloud-based services that organizations can deploy without a heavy IT lift. We're really lowering the barriers to entry for healthcare practitioners on one side. But these tools are available to any player who wants to enter the space. And so we're lowering the barriers of entry for people to get into healthcare. And in the last few years, I think partially accelerated, like so many things, by the pandemic, we've seen a host of non-traditional players make announcements, right? Whether it's the expansion of CVS Health that became the vaccine provider in the United States across the nation for booster shots in COVID, whether it's Walmart or Amazon talking about Amazon releasing a telehealth service, right, now as a product, expanding beyond their own employees. We see payers and insurance companies experimenting with new models. And even several years ago, giant payers like United Health would say to me, no, we're not really a payer. We're the world's largest primary care provider, right? Or the nation's largest primary care provider. So I think with what you're saying is with these lower barriers to entry, it's not just that traditional healthcare players can transform, right? Maybe they have to start transforming because a lot of these other companies who are more native digitally to these tools are entering the space, right? Again, add direct-to-consumer telehealth to that mix. Add what's happening with drug companies, traditional pharma, and sort of newer, some sort of newer companies with drugs in the marketplace where they are marketing directly to consumers, right? Do you see these kinds of new players really using these tools quickly and effectively? And do you think traditional healthcare can catch up? Or is there something new happening that's really going to shift the paradigm in the future?
So I think the way I would first kind of approach this is that with the cloud, there's been a democratization of technology in a sense, right? And I use the term citizen developer, that it's an intentional term out there that really is meant to convey the thought that this is an accessible way of going about and working with technology to drive value. I'm in general a big fan of the history of science, the history of technology, and both the science of history. But maybe we focus on the former, because one of the things that I've found, and kind of hopefully being a little studious in this space, is that oftentimes technology, science or theories are identified, and real solid application of them are not until a little bit later. And it's not always in terms of history sequential, in terms of this was done and then that was done and then this came out as an output of it, right? One example I like to think about is, the concept of transformation dimensions, from one to another, 2 dimensions to 3 dimensions, and then 3 dimensions to 4 dimensions. When that gap, or when that leap between 3 dimensions and 4 dimensions occurred, for transforming space, that is, everybody was like, so what? That's cool. Nobody's going to ever find a use for it until, 50, 60 years later, along comes Einstein and says, well, you know what? Now I've got an application potentially for 4 dimensions, and that's the addition of time to space. And I think one of the things that I am seeing as a potential benefit of this democratization of technology is we're now expanding the pool of individuals who can find application for machine learning, for artificial intelligence. And yes, this includes individuals, but this also includes organizations. And I think, at the end of the day, with respect to this, that is the main difference. And then also the fact that there is a proliferation of individuals who have some information technology experience or background as well should help accelerate this type of thing. There's always been this big, kind of a promise or aspiration of what AI or what transformation will mean. And for the large part, it's been superficial. I think that we are probably getting close to the place where there would be enough momentum and process and culture within organizations to really begin to move that forward. I think in specific, one thing I would say as far as the changing market about, how can we get a non-traditional players involved in this space? Perhaps not so much on completely out of left field, but somewhat involved already within the providing of healthcare or life sciences organizations. Life sciences organizations that would engage typically through an intermediary in like a business to business to an end consumer perspective, and now engage directly with end consumers. One thing I would consider with respect to this, again, as a result somewhat of COVID, is, as individuals got their shots, got their vaccines, and got boosted, they could scan a QR code. They could scan that QR code that could get them in touch with maybe, the pharmaceutical organization that produced the drug, and they could report symptoms that would not have gone upstream previously because they were not severe in some capacity, and therefore potentially lead to a further reformulation or refinement of that formula to avoid less severe symptoms, and then hopefully improve the overall healthcare outcomes associated with oftentimes pop psychology that gets so much place in healthcare today. Avoid some of those potential downturns as well.
So you've hit on 2 of my favorite themes, right? One is the disintermediation of the market by digital and the potential that has to transform, not just streamline care, but to transform the economics of care, right? There are a lot of middlemen in between life sciences and drug companies and consumers today that are generating, The Economist magazine puts it, right? They are rent seeking at levels that almost no other part of the economy does. And the other half is the activation of patients, right? So anybody who's been around this for a long time, like I have, I think sees a couple of things, right? So my favorite example is this. I'm a chemist by training. My wife's a physicist. And when I got to medicine, working around hospitals, I realized that medicine was one of the only sciences that does not appreciate the input and the contributions of amateurs, right? So astronomers routinely reward undergraduates and amateur astronomers with telescopes or setups in their house for discovering objects, right? That is not uncommon. In the chemical area where I was, right, and during the American Chemical Society, would routinely give an award to a non-professional for material science, new inventions, new compounds, new plastics, new rubbers, new other things. Most sciences have some sort of formal and structured appreciation of the work of amateurs, but medicine doesn't. And my favorite example of this, right, is a 20-year-old Monty Python movie, the Monty Python and the Meaning of Life, where there's a chapter about giving birth, and there's a woman in a delivery room, and the doctor is screaming, "Turn this machine on!" It's the machine that goes bing. They talk about how this machine tells you whether your baby's alive, and the woman looks up and says, "Nurse, do this. Doctor, do this. You turn this on." And the woman looks up and says, "What should I do?" And the doctor looks at her and says, "Nothing, dear. You're not qualified." And so that's been the experience throughout healthcare for a long time. And I love the word democratization that you use, right? So we now have real world evidence. I think that's kind of what you were talking about with what's happened during COVID. The collection of real world evidence, people who are receiving vaccines directly reporting to the company that made those vaccines how they're feeling, how it's doing, etc. And that to me is a very important way to involve people more in their care. If we couple that with the idea that we have of the democratization and the appreciation and the contribution of non-traditional players into medicine, I think what we're looking at is a bright future for healthcare in general, for the consumer experience, for the provider and patient experience, and for all of us. And the last thing I'll say before I turn it back to you for some comments here is you use the word digital, I think you use citizen developer, right? One of the differences I find in my career between the United States and the rest of the world, right? Although the rest of the world doesn't quite have the socialized healthcare that we think it does in most cases, it is more centralized and it is more generally considered something that governments provide for benefits. So outside the United States, when I talk to people, they talk about serving their citizens, right? So not only do you have these citizen developers, right, but you have these citizen patients. They're not just patients. They're not consumers for sure. They are citizens who are deserving of treatment by their government to some level. United States, we're a little bit different the way we think about that. But nonetheless, this idea that we're all health citizens. A friend of mine and a longtime HIMSS contributor is a healthcare economist, and she talks about being a health citizen, right? I'm a citizen of my own health, and I'm the sort of master of that domain. I'm the mayor or the president of my healthcare. And so when we look at what these tools are doing, we look at what transformation is doing, we look at life sciences in particular in the examples from COVID, what do you see for the next few years, right? Do you think, I know you mentioned there's some regulatory barriers that might come back, but for the most part, do you think we're on a path here that we're going to be able to sustain? Are we waiting for one or two key killer applications to really energize it and make it possible? Or do you worry sometimes that we may have started something that's just going to disappear again because of whatever forces are out there?
I, you know, I do worry. Maybe that says a little bit more about me than much, but I mean, I see in the next couple of years, I see opportunity. I'll be a little aspirational here. I think maybe there's a little place for that. I think data in terms of, providing an additional contextualized look at data, making an attempt to standardize or interest of making data both complete and accessible is going to be really important. I mean, I think one thing, there's a few threads here, I know, but I want to kind of explore maybe a couple of them quickly. I think one thing that kind of happened that as a result of COVID as well was in terms of how can we capture both the complete and accurate data that provides the contextual need for the specifics at hand. Now, one thing I'm thinking about in specific is, for example, when it came to COVID testing, if there was an address that was requested as a part of the testing process, oftentimes what would happen is it was not necessarily, so individuals would not necessarily put the address where they were receiving healthcare or where they were receiving the test. They would put their home address, right? And so what oftentimes would end up happening is the data that was gathered as a result of these tests, especially if they were in a vacation area or something like that, would not necessarily indicate where the next hotspot would come. I think we talked about a little bit about real world evidence. And oftentimes what ended up occurring sometimes in, especially amongst public health officials, is that there was a lot of educated guessing and some of that pop psychology. And I think that in order to compensate for that, frankly, lack of contextualized data or incomplete or inaccurate data, and that potentially eroded a little bit of public trust within certain institutions. And something that technology could definitely help with is like what would probably have been more important is where were you when you were getting this test? Where were you when you would receive this test? Location services. Everybody's got location services, at least somewhere on their person, most likely. I mean, and then I think even to kind of expand on the data point is that complete longitudinal patient 360. I think that's something I would like to see. I think when we talk about machine learning and some of the other kind of data areas, we need to have, there's that adage, garbage data in, garbage data out. It doesn't matter how much transformation processing, whatever type of layering you want to put on it, it's still going to, you're still going to have these big massive gaps potentially. And I think the thing that we're running into right now is that it's both a technical challenge, it's a standardization challenge, in order to capture this. And I think it's not just the capturing of the data itself. One thing that I work with and we work with a lot is also how we represent that data in a visual format. Not just in the dashboarding of data and reporting and analytics, but also in how you're viewing that data. Working with different clinicians, even in different disciplines, talking about, hey, you know what do you see at the top left? What would you like to see first? What would you like to see next? And then incorporating a design element into how we would be presenting this information. Because one of the things that I'm seeing a lot, or I hear a lot as well, is clinicians are spending a lot of high energy analytical thinking just piecing together information. And I think if what we can do is we can help bridge that gap in terms of not having that be as part of a little bit more of the autopilot part of the brain, so that they can focus that high energy analytical thinking process by engaging with the patient, coming up with care plans and the like, is something that a complete data reformulation would be important. Now, there's a couple challenges even within there as well. I think the sovereignty of that data, essentially in ownership. I think that's going to be something that's going to be pretty curious to see how it shakes out. If this is something that moves forward, of course, the risk of something not being done well has the potential to really draw it back, as you said, as you were alluding to, and then temporarily put a hold on it. I don't think you can really, I think the march of progress is well on its way in this direction. It's just a matter of execution. And I think the authentication of who owns this data, is this government? Is this some sort of a national standard? If, for example, in the United States, is this something that could be like more institutional standard? Who would then operate against that? And then who at the end of the day would own it if it's an individual, and the authentication process around that biometric social security number, making that less frictionless and then also transferable, right? Accessible would be key. I would like to see that. That's where I would go.
The good news is we just came off of our annual global conference. Well, I guess it's back to annual now. COVID had disrupted that too. So, and there was a great deal of talk about the blockchain and cryptocurrency in healthcare, but more importantly, it germane to this conversation, right, was a significant number of people starting to think about how people turn their own data into an NFT that they can then have some control over. They can then have something. So to your point, as outside forces begin thinking about how to apply non-traditional technologies to care, there's some what may seem like wild ideas out there, but might be a little closer than we think. So I want to bring this. We're getting a little bit close to the end of our time here. I want to bring this back with one final question. And you said something earlier that is the lesson that I and every other parent has probably tried to teach their teenager at one point, right? Which is the most important thing to do is just get started, right? It's good to have a goal, but sometimes if you don't know exactly where you're going, take that first step anyway. The road will start to reveal itself. So if I'm a life sciences company, right? Not some multi-billion-dollar international life science company, but I'm, somewhere in the United States today, there's some people with an idea, and they have a biologic that may be progressing through regulatory approval, and they're looking at how they're going to go to market, how they're going to interact with the market. Or I'm a healthcare provider, or one of those hospitals that's not attached to a giant integrated delivery network with billions of dollars of money and giant IT departments, right? How do I get started? Right? What do I look for in a partner? Who do I turn to and maybe people I already do business with? What kinds of tools am I going to be in that first layer of deployment? What are your advice to people who want to get started?
Absolutely. And I think, yeah, getting started is super important. I think also, and when we get into the details, we can explore uh, also just the point that good is not the enemy of the great or the perfect, right? Improvement is, I think, and yes, that's the difference between maybe change and transformation. Obviously, sometimes transformation can be scary. Even change can be scary. But I think at the end of the day, acknowledging that improvements also is not the enemy of the perfect or of the great is going to be really key there. I mean, I think so from a technology perspective, I think there are different applications on the marketplace that could definitely be of help. I think, just a couple things, and then there's also going to be a process component. There's going to be an implementation component. There's going to be a culture and a change management component as well. I think one of the things I will mention just quickly off the top is Microsoft has Microsoft, both in terms of what they provide around identity, security, and compliance, what they provide as far as business applications, their investment into an overarching cloud that incorporates collaboration, productivity, business applications, artificial intelligence, analytics, data, as almost a software as a service model is definitely something that would be is again, it's more accessible to get started. And in addition to that, with acquisitions around nuance, around like things we had talked about, like dictation, ambient clinical intelligence, medical advice, it's really helped drive those home. I think partnerships also in terms of how we implement technology is going to be important. I think, from my perspective, I like to start with focusing on value or business impact, understanding the current state challenges and the goals. As I mentioned, decomposing those into strategies, capabilities, both technology perhaps, but also process and measurements. And an important thing there is memorializing the measurements, specifically because I think that's going to help derive what that value or what that return on investment actually would look like. So at the end of the day, I mean, I think the quick answer is it's people, partnerships that you're working with, and also the change management component of identifying the benefit for adopting technology or change. Process is going to be significant because you're not going to be able to do everything in a big bang, right? We're going to have to be measured. We're going to have to iterate. We're going to have to learn from potential missteps. And then also the technology component is really significant here because it is what enables those goals. It's what enables you to resolve your challenges. Oftentimes conversations, and sometimes I fall into this myself, start with technology, start with process automation, start with self-service. Those are capabilities, right? I think where the beginning would have been is, hey, you know what? I am less likely to go to my scheduled doctor's appointment if I can't reschedule it on my own because I work during the day. Everybody else does during the day. Think about going to a bank during the day. The fact that now you can do banking at home on your mobile device is improving the engagement that an individual financial institution would have with an end consumer. Let's look at applying some of those similar thoughts in terms of learning from other highly consumerized industries already to the healthcare and the life sciences space. I think learning in terms of what those have done is also just another big significant principle I would also key in on, amongst other things, I'm sure.
Well, you've given us plenty of things to think about today. So I'd like to say thank you, Corey, for giving us some of your time. giving us the concept of citizen developer, looking back at some of the things I wrote down, reminding us about the difference between transformation and change. Right? These are all important things that were big parts of our conference discussion. There'll be big parts of our conference discussion next year. This is going to be a journey, not just an overnight transformation. So I appreciate your insights. I'm sure our audience does as well. And thank you for joining us today.
My pleasure.